that we gave them. On patient arrival, verify no alcohol, caffeine, or tobacco use previous to the exam 3 hours before. Remember, like you said, people who have these habits, probably they gonna lie to you, but hey, you do your best. You can't just go there and tell them, oh, no, you didn't. Are you sure you stopped smoking? You smell smoke. No, this is not up to us. We do our best. If they don't want to follow it, sorry, it's your life. And that's what you said, and it's written there. So no worries. Medication stop if required. Remember, if there are certain medications has to be stopped, you gotta check them out. You gotta verify that this person is meeting all the requirements before you do the test. Patient medical history is completed. That's the doctor's job, not ours. Consent form is signed. That's the doctor's job also. If you have a question on your exam when they ask you, who can send the patient to do a procedure? Anything. Not because it's surgery, no. If it is a procedure, the doctor. So what is it that medical assistants do? We reinforce that. Exactly. We go there and we ask. We need to check the medical records before the doctor gets in, and I have the patient right here, and I'm preparing my patient because I gotta make sure that meet all the requirements. Then I'm gonna see, oh, here is the consent. The patient have signed it, the doctor have signed it, I'm fine, everything is in order. Is that understood? No delays. Because remember, the doctors come to the office or to the exam room and they don't check anything. They just see that you have the patient right there ready and they start like nothing else. It is our job to make sure that all of this is met. So that's basically what it is. So that is important. Consent. You gotta know about consent. Remember, in the national certification, they ask you about consent. Implied consent, express consent. You need to know those. Now we're gonna prepare the patient. Remember? So during a regular electrocardiography, we do something similar. Here, we're gonna go a little extra, because we need to make sure that that area, when we're going to apply those electrodes, is really, really clean. So we're going to abrade that area. When you clean, it's going to look like this area is going to be red. Is that understood? The patient might complain a little bit. That is the only way. You clean it, you make sure that that area is clean so these electrodes can adhere without any problem. Rub side with alcohol, swab, let dry. See? Abrade, rub the skin. A little hardshy, you know what I mean? Because this electrode needs to attach right here. During this EKG electrocardiography or electrocardiography exercise, attach blood pressure cuff and electrodes according to manufacturer's instructions. Remember that I told you whenever you need to see instructions, who you're gonna ask? You're not gonna ask anyone. The manufacturer instructions book. That's when you always, for the exam, that's how always you're gonna do. Okay, the doctor said that you're gonna be doing this particular test, but you are not familiar with the test. Where are you gonna look? The manufacturers. Is that understood? It says right there, perform a resting electrocardiography first. You're gonna do an electrocardiogram, a regular one. The one that the patient is laying down, and you apply the 10 electrodes. And you give the copy to the doctor before we start. Why? Because we need to know the basis, a base EKG, to see then when I'm working on this, what the changes are now. What is the difference? So that's basically what we do.
It's raining?
It's raining again?
It's pouring.
Oh, no worries. We stay here until it stops. Pay attention to this part. It's important. This test is going to be divided. When we do an exercise electrocardiography, we're going to divide this test in 2 stages of 3 minutes each. Does not imply that it's going to be 6 minutes. No, we're going to stop every 3 minutes. So remember, it's 45 minutes, right? Or an hour. So we're going to go 3 minutes, we're going to stop. 3 minutes, we're going to stop. Why are we stopping every 3 minutes? Because we're going to check for blood pressure. Every 3 minutes, we're going to check for blood pressure. That's basically what it is. At the end of each stage, blood pressure is checked and EKG is repeated. Remember, the same machine that we have right there is the same machine that can get an electrocardiogram because we stopped, right? So the patient now is at rest. So for that reason, we do an electrocardiography. These questions usually don't come on the test. Says right there, exercise period may last up to 50 minutes depending on patient's cardiac risk factors and ability. Once again, if the patient complains about chest pain 3 minutes after we start, it didn't last 15 minutes. But sometimes the patient starts doing well. That's after 15 minutes is when the patient starts complaining, okay? Or we see changes on the patient EKG. Says right here, physicians may terminate tests if conditions that may lead to complications are identified. Because the doctor is checking, the cardiologist is checking how the EKG is changing as the patient is on the treadmill. They're gonna make a decision. I'm gonna say, okay, time to stop. The doctor just stop because they have control close to the computer for the treadmill. So that's how they do it. Okay, so we have a protocol. So every single exercise electrocardiography has a protocol. This is the most common protocol. So the goal of a test target heart rate, which is called THR, is 20/20 minus the patient's age times 60 to 85%. Now, I'm going to tell you how this is done easily, just in case you have one of those questions. So, these questions, nobody have told me about seeing the end of the test. But it is important that at least you have an idea how you're going to calculate this target heart rate. So how this works. So let's put it this way. Because if I write it down, you can understand it better. Because the way that you see there is a little complicated. So let's say that 220 is the maximum. 220 is how high the heart rate can go on a patient. Is that understood? Yeah. 220 is part of the protocols, but it's not actually 220. 220 minus the patient's age. Let's say that your patient is 40 years old. So what will be the target heart rate for this patient? 220 minus 40. Got it? So what I did here? So forget about this percentage right here. We do it very easily. Patient's target heart rate is 220 according to the protocols. Now, or standards, or by default. The patient is 40 years old. So what we do is we minus the age over the heart rate, and this is the heart rate for the patient. So let's say that I have this 40 years old patient that is walking on the treadmill. I don't have to wait until the patient reaches 220. No. I have to wait until the patient reaches 180. Because if I wait a little more than this, my patient is going to collapse. Because this is the highest it can go. This is kind of the limit minus the patient age. So I have a patient who is 70 years old. What will be the target heart rate?
150.
Correct, 150. So when this patient reaches 150 beats per minute, I have to stop the machine. Even though the patient is feeling good, no changes, I have to stop because the patient reached the highest target heart rate. So if you ever have a question, they're going to give you this. What is the target heart rate for a patient who is 60 years old? Is that understood? Then immediately you need to remember 220 because they're not going to give you that. You're going to remember 220 minus 60. It will be 160.
160. It's 160?
No, I'm asking you.
No. It's 1. Wait, hold on. Because I was doing it in my head.
Was 220 take away what?
Oh, 60.
Isn't that 160?
Yeah, it's 160.
Okay.
Yeah.
Beats per minute. So you will look for the answer that is 160 beats per minute. Just remember that anytime that they ask you for the target heart rate, you're gonna use 220 minus the patient's age. That's it. So it's easy that way.
Yeah.
So not kind of having trouble finding it. During the procedure, what's gonna happen during the procedure? Remember, we're gonna monitor the following: blood pressure, pulse, signs of cardiac distress. Once again, that's the doctor. And we are going to be checking the oxygen levels. How do we check the oxygen levels? Because we're gonna use the pulse oximeter. If you notice, the patient is right here on the treadmill, the doctor is in front of the screen checking all the information, and the medical assistant should be in this side checking the patient. So we're gonna be monitoring the patient all the time. This is important because if questions arise on your test, this will be. During the procedure, watch patient closely, including skin color. Remember, if the patient becomes red or flush, would you stop the EKG?
Yeah.
No. Why? Because when the patient walks, we tend to become red.
That's supposed to be.
But it's the other way around. If the patient becomes pale, no oxygen.
Then you stop.
Patient is gonna collapse. Patient starts sweating profusely. If he's just sweating a little bit, no, we're not gonna stop. That's normal. But if he's sweating profusely, why? It's getting dehydrated. Collapse. Amount of perspiration, that's called diaphoresis. Sometimes I have seen this question on national. I have seen. I have been told. Amount when they said perspiration or heavy sweating. What is the medical term for that? It's called diaphoresis.
Dia what?
Diaphoresis.
Phoresis. Okay, diaphoresis. That's when you sweat a lot?
Yeah.
I can't wait to use that. Like, oh my
Right.
God, you
You
got
got
that diaphoresis. Like, come on. It's getting on me.
That me.
When you tell someone that has diaphoresis and you say that word, they
gonna
think
think
that
they
you,
got
yeah, they're gonna die.
Yeah. Like, no, it's just another word for sweating a lot.
Okay, so with this, that's it. This is how we're gonna place the electrodes. You see them?
Yeah.
2, 4, 1, 2, 3, 7, 8. Now, if you look at this one, it has 10. 1, 2. The ones that goes on the arms goes right here, remember? By the collarbone. Then 2 here. 1, 2, 3, 4. Remember B1, B2, B3, B4, B5. And on the sides of the abdomen. So that is how it's done. So for this one, you will do 10. So some of them uses 7, some of them uses 5. So once again, we'll see which ones are. Factors used to interpret the results. That has nothing to do with you. But we're going to check the heart rate, the blood pressure, changes in oxygen levels. Again, that's not you. This is just part of it. This will never be asked. Do not verify or exclude a normality. That's for the doctor. Sometimes the test is inconclusive. Inconclusive means we don't find what we thought we were going to find. The patient is not going, it's not developing shortness of breath or chest pains when we put them to run or something like that. So it's inconclusive. Do that mean that the patient don't have heart problems? No. We have to do another test, something different, because the patient is actually complaining about that. That was the reason that we sent for this test. But not always these tests are done correctly. If that happens, then we have to send for an echocardiogram or coronary angiogram. So those are more advanced tests, more expensive, more risky. So the ultrasound, not much. Remember, the ultrasound is similar to the one that we use to check the babies. We just put something on top of the ultrasound with jelly and then start rubbing around and seeing the blood vessels through there. Seeing if they have obstructions, if they move, they are stiff, the blood vessels, if the blood is running through or not. Coronary angiography is when we put some catheters through the arteries and we put some dye, some chemicals to kind of make the blood vessels seem better inside. They're not gonna ask you about this. What happened after the patient finished? This is the last 2 slides. So right here, rest for several hours. You tell the patient when the procedure is done, don't go do exercise, don't do anything. Relax for a couple of hours. Avoid extreme temperature changes. Remember, you already kind of dehydrated, you're sick, you're not a normal person. So after all the things that you went through, kind of chill a little bit. No bath or shower for 2 hours. When you sweat, what is it that you're gonna go do? Take a shower. This is not recommended immediately. You have to wait at least 2 hours to go take a shower. Okay? You should not go take a shower after doing this exercise. The test results usually are 10 days after the procedure was done. Now, that is the policy of the organization, the doctor, or the cardiologist that's doing this. So we should have that policy right there. So we should know. Remember, most of those things the doctor tells them. We just reinforce that. What is reinforcing? We're going to repeat them because the patient forgot, because we want the patient to remember them. But we're going to give them written instructions. That is basically what it is. If the patient asks you questions about how the tests go, what is the results, remember, as a medical assistant, we don't give diagnosis. We refer them to speak to the doctor, to the physician, whoever did the test. Is that understood? Period. We don't get involved. Oh, the doctor is going to talk to you. When the results arrive, they're going to call you, they're going to tell you, okay? That's it. Done.